Streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making rounds live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making rounds live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. On today's broadcast, we connect with leaders and experts who are shaping healthcare right here in our community. And today, we have some exciting news to share. Methodist University and Cape Fear Valley Health's brand new state-of-the-art School of Medicine has officially received its accreditation approval. And that means they're one step closer to welcoming their very first class of medical students this coming summer. Now, joining us today to talk about this milestone is Dr. Hershey Bell. Dr. Bell, he has an interesting story, and I'm going to let him tell you about it. But he is the Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. Now, he's going to walk us through this new moment that is approaching the community and tell us about what's going on next and so much more. And after that, we'll talk to Ms. Zyla Horgan. Ms. Zyla, she is a medical resident at Cape Fear Valley Health, and she is going to share some important insights on fibroids and women's health, something we really haven't talked about too much on Making Rounds Live. Now, before we get started, remember, this show is for informational purposes only. This is not a time for you to self-diagnose. If you go through anything that we may discuss today, especially during the second segment, make sure you find yourself a healthcare professional. Now, ladies and gentlemen, it's time to introduce our first guest, Dr. Hershey Bell. Now, before we talk about the buzz that's going around the health system and the community, let's learn more about Dr. Bell. Now, first, Dr. Bell, welcome to the broadcast.
Thank you so much. It's good to be here, Omega.
Now, who is Dr. Hershey Bell, and what is your role at Methodist University and at Cape Fear Valley Health?
Well, thank you for having me on the show. At Methodist University, I am privileged to be the founding dean of Methodist's brand new School of Medicine named after Cape Fear Valley Health. And at the health system, I work with the leadership team to help us reorient ourselves to becoming a truly academic healthcare system, similar to what you see at Duke University, UNC, Wake Forest. That's the future of Cape Fear Valley. So my job there is to work with the leadership team and also with Dr. Mahardy, who I believe has been on this show, to help affect that change. My background is I grew up in Canada, Toronto, and I did watch the Blue Jays lose last night, so apologize if I'm a little tired. It was a long game. But I grew up in Toronto. I went to medical school in Canada, and I studied family medicine and did my residency and fellowship down here in North Carolina at Duke University, and had the privilege of entering my career in academic family medicine in the mid-'80s. And I eventually found myself at Lake Erie College of Osteopathic Medicine, where I served as dean of their School of Pharmacy and vice president of academic affairs. Along the way, I had a job back in 2000 at a hospital in Erie, Pennsylvania, where I hired a young man fresh out of Buffalo who was looking for his first job in healthcare. His name was, I got to think his name was Mike Nagowski. Yeah. So Mike and I go back about 25 years. We were a great team. And in 2019, I called him because the college I was at was looking to start a medical school in the South. And I called Mike and I said, "Hey, Mike, are you interested in starting a medical school?" And I just heard laughter on the other end of the phone. I said, "What are you laughing about?" He goes, "I was just about to call you." I didn't realize that Cape Fear Valley had on its agenda the desire to start a medical school. So one thing led to another, and I'm here. I've been living in Fayetteville since 2021, and it's all about starting a medical school and mission accomplished.
Well, so what made you take on the role as founding dean?
Well, it's funny. It's not a question I have a good answer to, other than I knew as a family physician what I believe most in, and I'm retired from practice now. But when I practiced, it always was on my mind that, and the way I tell the story is, if I saw, for example, a patient with diabetes who was out of control because they couldn't afford their medicine. The question for me was always, if I'm seeing one person, how many are there in the community that have the same problem? And I always took a population health perspective. So when I heard the reason why Mike wanted to start this medical school, and it was really to help improve health outcomes in the community, I said, that's all I've thought about for my whole life. My goal is to use this medical school as a means towards improving health outcomes in our community, and they need improving, Omega, for sure.
They really do.
Yeah.
They really do.
Yeah.
This area, for every medical issue, I think we're number one. We're at the top of the list. Everything from diabetes to high blood pressure. The list just goes on and on.
Yeah, I look at two statistics primarily, Omega. I look at information out of the Shep Center at UNC, where they chart the number of physicians per 10,000 population. And no matter what specialty you look at, we have less doctors than we need in this community. And then I track that against the actual rankings of health outcomes for every county in North Carolina. And when you look at that, and there's 100 counties, we're surrounded in our region, not a good number to be at. Numbers 100, 98, 95, 88. Cumberland County is 72nd. We're the 7th largest city in the state, and we're ranked 72nd in health outcomes. But when you look at where are the doctors, where the health comes high, there's a common denominator, where the medical schools are. Orange County, Durham County, Wake County, Forsyth County. The county that I pay a lot of attention to is Pitt County, because Pitt County looked a lot like us 50 years ago, and what did they do? They started a medical school. And now they're ranked 42nd in the state, and they have sufficient numbers of physicians in every specialty. That's the future of healthcare in southeastern North Carolina.
Dr. Bell, we're going to talk more about the lack of doctors in the rural areas in just a bit. But ladies and gentlemen, our guest today, Dr. Hershey Bell. Dr. Bell is the Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. Now, if you would like to join in on this conversation, excuse me, two ways you can do so. First of all, you can give us a call at the WIDU studio. That number is 910-483-6111. Again, 910-483-6111. Miss Glenda, she'll pick up the phone. You can either come on the air and talk to us. We have a way to do that, or you can just ask the question and Miss Glenda will get it into us. Also, if you're watching our live streams on either Facebook or YouTube, you can leave, or on Facebook anyway, you can leave the question in the comments section. Lindsay, she is our social media coordinator. She is making sure that we get all of this on, all of the information on for you, and she'll make sure that we get that question to the experts while we have them here today. Finally, I want you to share the broadcast. We're discussing a lot of information, too much information for you to be a middleman, and you're going to miss half of it anyway. So share the broadcast. That way you don't have to be the person to miss something in the translation. But ladies and gentlemen, our in-studio guest, Dr. Hershey Bell, we're discussing the new medical school and that's coming to the community by way of Methodist University and Cape Fear Valley Health. Now, Dr. Bell, let's talk about the accreditation.
Yes.
The School of Medicine has officially received its accreditation. What does this mean for the community, and why is this such an important milestone?
So the first thing that people need to realize about an accredited MD school is there are only 150 in the entire United States of America. And one of them is now here in Fayetteville, North Carolina.
Oh.
And just let that fact sink in for a moment. That's a remarkable achievement in itself. Accreditation of a medical school means going through a very rigorous process. We, I sort of kid, Omega, you could send a letter to the accreditors today with a check for $25,000, and you could tell them, I want to be a medical school, and they would say, fine, you are now an applicant school for accreditation. That's all it takes. But within 18 months, you have to submit a 700-page document showing them that you can actually do it. And we were able to do that ahead of schedule and received what was called candidate status, which meant we were now a candidate school for accreditation. That was a year ago in October. That leads to a site visit. We had a team from the Liaison Committee on Medical Education, they were our national accreditors, visit Cape Fear Valley in May, and they reviewed every aspect of what we were doing. They focus on what they call the 3 Fs: finances, faculty, and facilities. And they grade us against 12 standards and 92 elements. And at the end of the day, they had one single comment. They said there were 2 committees that you had mentioned in your papers that weren't listed in your bylaws. So across 92 elements, 12 standards, that's the only thing they could find.
Wow.
What they were really saying to us is, wow, Fayetteville, you deserve a medical school.
Job well done.
And I'll tell you, it's not because of Hershey Bell. It's because of a leadership team at Methodist University, Dr. Stan Worden, Dr. Suzanne Bloom-Malley, and their entire team. Shout out to Dr. Meredith Gronsky, one of my colleague deans for health professions at Methodist University, and then of course the magnificent leadership team at Cape Fear Valley and our physicians. Our physicians are the faculty of our medical school. In Cape Fear Valley, with 8 hospitals, 1,000 physicians, we have what it takes to do medical education. And the LCME saw that, and they told us just last week, congratulations, you've achieved accreditation. And the accreditation we have is called preliminary accreditation, so there's 3 you have to go through. Once our students finish 2nd year, we're eligible for provisional accreditation, and when we graduate our full class, full accreditation. But the key word that I keep telling everyone, Omega, is accreditation. We have an accredited medical school. I like to kid because I know for sure some of our friends from those basketball playing schools up north are listening in. And I like to say that, we were on this list of schools who wanted to be medical schools. Now we're on the same list as, let me think of their names, Duke University, UNC, Johns Hopkins, you name it, we're on that list now. So it's an incredibly important thing for a community to have an accredited school.
Ladies and gentlemen, we're talking to Dr. Hershey Bell on Cape Fear Valley Health's Making Rounds Live. Dr. Bell is the Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. Now, Dr. Bell, you pretty much shared this story in the beginning of the broadcast, but in case someone is listening, I want them to hear it again. The partnership between Methodist University and Cape Fear Valley Health. Yeah. How did all of that come together again?
So it's a really great story. So Mr. Nagowski, when he got here in the late 2000s, had a vision for a medical school and was already thinking about it. And when Dr. Worden came on board as the president of Methodist University, and by the way, there's a common denominator here. When Mike joined us as CEO and when Stan joined as president, the chairman of the respective boards was a local physician by the name of Dr. Rakesh Gupta. So Dr. Gupta is a common denominator between the two. So Mike and Stan actually spoke about the possibility of medical school. There were consultants involved, and the trouble with consultants is they sometimes don't give you the best advice. And the advice that we were given early on is, maybe you should look at a university that already has a medical school if you're going to start one. So Mike explained to Stan that we're going to look at that route, and we explored it for a while. But in 2022, better heads prevailed, and there was a great meeting right before Thanksgiving 2022, the leadership of Cape Fear Valley and the leadership of Methodist, and we looked at each other and said, can we do this together? And it was a resounding yes, and only 3 months after that, we had our press conference, February 2023, announcing this magnificent partnership between a great university that has not only does it have a breadth of study across, what a liberal arts education should provide, but it also had a very strong footprint in health professions. And then, of course, Cape Fear Valley and all the resources it brings to the table, truly a marriage made in heaven. And Cape Fear and Methodist together are raising the money for this project. It's no small change. It costs, upwards of $130 million to start a new medical school between the building, startup operations, and these two great organizations have come together to find the resources. And we're honoring Cape Fear by naming the school the Methodist University Cape Fear Valley Health School of Medicine because of their significant contribution to this fundraising.
Let's talk about the physician shortage. We mentioned it earlier in the broadcast. We live in the Sand Hills, southeastern North Carolina. Our rural community, it basically consumes the area for the most part, you might as well say. There is a shortage of doctors out there. There is a shortage of health care out there. I know this for a fact. So how is this medical school going to help address that issue that's going on in Robeson County, in Bladen County, in Sampson County?
So I want to point to a couple of words that exist in our mission statement at the school. Right at the beginning of the mission statement, it says that we are a socially accountable, community-engaged medical school. What does that mean? It means we don't just exist in the community. We're here to serve the community and to help the community solve its health problems. Community engaged, we are going to listen to our community. In fact, we had a first meeting of our Community Engagement Council just last week where we heard from folks in every one of the counties across all economic sectors, what does a medical school need to do for you? Our students are required to do a community service project as part of their education independent of medicine. In other words, the community service project may have nothing to do with their medical education, but it will have to do with the need identified in our community. I learned this from a great friend, Roger Strasser, who opened a medical school first in the outback of Australia and then northern Canada. And what he taught me is if you immerse your students in communities that need physicians, they will get to appreciate what their value is in those communities, who the people are, how great they are, and they're going to want to practice there. So that's how we're going to solve the problem, Omega. We're going to immerse our students. Our students are an army of service volunteers who are going to make a difference as students and then go back and serve those communities as their physicians.
Ladies and gentlemen, with us today, Dr. Hershey Bell on Cape Fear Valley Health's Making Rounds Live. We're talking about the Methodist University Cape Fear Valley Health School of Medicine on today's broadcast. Dr. Bell, what type of students are you hoping to attract to the School of Medicine? Are there particular qualities or values that you're going to look for?
So first and foremost, I hope we attract students from our region to be our students here. There are not enough seats in North Carolina right now for all the North Carolina students who want to stay and do their medical education here, so we're going to help solve that problem first and foremost. But ideally, students from southeastern North Carolina. But it goes back to the mission. I am looking for students who want to be socially accountable, who want to be community engaged, who want to solve population health type problems. Now, our students will graduate to be physicians in every specialty because part of the way you solve population health problems is you are a specialist in trauma care, you are a specialist in vascular medicine, a specialist in obstetrics gynecology. It's partly how you solve the problems because you provide the care that's needed so people don't have to travel to get care. You increase access. But we're looking for students who want to meet that mission, who want to be socially accountable, want to be community engaged, and want to serve our communities. Now, there's also rigorous standards for medical schools. You've got to have the grades. I'm not going to kid you. You've got to have the grades, and our students will have those grades. Right now in this country, there are 2 applicants for every position available. So there are a lot of people looking to fulfill their dreams to be physicians and not enough positions for them to fill. So we know there are really great students out there. I hope the ones living real close by are the ones who apply. We opened our admissions just yesterday. We opened our admissions. Within the first 4 hours, we already had 50 applications.
Get out.
And I know for a fact that a number of them came from this region.
Awesome.
Yes.
Ladies and gentlemen, Dr. Hershey Bell on Cape Fear Valley Health's Making Rounds Live. Dr. Bell, local physicians and local staff, is that going to play a role as far as mentoring and teaching these medical students?
Absolutely. You know, our physicians are our faculty. And we've been blessed that we have graduate medical education at Cape Fear Valley. We have over 300 residents already training, you know, physicians who graduated from medical school who are now trained to be specialists. And we are proud of our faculty. But I'm going to tell you something that a lot of people don't appreciate. So, and I'm going to be honest with you, Omega, I think it's important we tell the truth here, right?
Okay.
Because I was up there in Durham for a few years working at one of those basketball playing schools. And not everybody appreciates what we have here in Fayetteville. And there were a lot of physicians who never gave a second look to coming to work here. Since we announced the medical school in February 2023, and I have the privilege of getting to interview every physician who applies to Cape Fear Valley as part of that team. We now have people who never even heard of Fayetteville, who want to be here. Why? Because they want to be part of the medical school and medical education. And then they learn about Fayetteville, and they learn about Cape Fear Valley, and they learn about Methodist, and they go, wow, how come I didn't know anything about this? And I've been living right here in North Carolina. It's already changed. We already have hired and have new physicians on staff who 10 years ago never even would have looked at Fayetteville. It's already changing on there.
High school students and college students listening right now, what advice would you give them as they prepare to apply for their dream in medicine?
Well, I'd say go back as far as middle school. That's when you need to start thinking about this.
Okay.
So I think the most important thing to think about if you want a trajectory towards medical school is start thinking about what are you going to do to serve people. So a lot of people think about grades, and I've got to take sciences and get good marks, and I've got to have experiences in healthcare. That's all good. You got to do all that stuff. It's all good. But start thinking about what it means to serve. Medicine is first and foremost, we're no different than the military. We're no different than police. We're no different than anyone who's in a profession where other people's interests come before your own. So start thinking about what does it mean to serve. And I promise you, if as a middle school student, high school, early college student, you have that framework, everything you need to get into medical school will fall into place. It's all about service.
Let's talk about local economy. You know I had to bring that in there, Dr. Bell.
I'm glad you did.
Local economy and workforce. What kind of long-term impact do you think the medical school is going to have on our local economy and workforce?
So we had commissioned an economic study about the medical school. I'm sure Mike's been on the show talking about it. But the projections are every single year, $72 million new dollars into our economy because of the medical school. Just $72 million. We've already hired over 50 people, 50 new jobs, high-paying jobs that didn't exist in this community before the medical school. We have physicians relocating because of the medical school. But here's the piece that I think people don't think enough about. Everything's about healthcare, medical school healthcare. But we want to attract businesses into this area, right? And there are businesses that come into communities because they know there's a medical school. They want to be part of what supports that kind of industry. But even if they have nothing to do with healthcare, what do employers think about for their employees? Are there good schools? And is there good healthcare? We're going to see businesses starting to come to our community. It's already happening. I speak to the business leaders all the time. I'm at those meetings. We're already seeing businesses relocating because they know they will get good education and good health care here. My favorite thing I've heard is someone once said to me, you know that research triangle? It's time to start calling it the research quadrilateral.
Wow.
Bring it down to Fayetteville.
Bring it on down to Fayetteville. Ladies and gentlemen, Dr. Hershey Bell with us today on Cape Fear Valley Health's Making Rounds Live. We're talking about the Methodist University, Cape Fear Valley Health School of Medicine. And Dr. Bell, he is the Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. The next major steps for the Methodist University Cape Fear Valley Health School of Medicine, what are they?
So we have to go through two accreditations, actually. One is the one I've talked about, but Methodist University is accredited by the Southern Association of Schools and Colleges. And we are going through accreditation with them as well. So because the medical school building is on the campus of Cape Fear Valley Health System, it's known as an off-campus instructional site of Methodist University, and that has to be accredited. Our curriculum as a new program has to be accredited. All that's moving forward as well. So a lot is going on at the university, and my colleagues at the university who are working night and day on seeing this happen, I can't thank them enough. At the same time, we're growing new programs at the university. The entire system is benefiting, so that's taking place as well. We're hiring faculty. We expect to hire 70 full-time people just for the medical school by the time we open July 2026, 100 within 2 years. I don't know if you saw that little building going up on Village Drive. Have you seen
Yeah,
it?
the one that's changing the skyline.
Oh, that
yeah.
one. That's right, yeah. So if you drive, and by the way, for all your listeners out there, if you haven't done it yet, drive along Village Drive coming from Robson towards the medical center. And as you approach the medical center, look straight ahead, you'll see this beautiful building.
Yes.
In fact, you'll see the beautiful glass feature. I've been
Yes.
kidding. I said we ought to put two eyes so it can stare back at you on that window. But it's a beautiful building, 5 stories, 125,000 square feet. The exterior is now finished. We're doing all the internal work now. That's going to be hopefully opening up in the spring of 2026. And of course, the big thing, the first students will arrive here in July 2026. And I'm not going to give away a secret because I want you to invite me back.
Okay.
But we're planning something big for their arrival in July 2026 for that first class.
All right.
I'm
Well,
going to tease your audience with that.
all right. Well, a marketing team, you already know we've got to have him back. You can't
There you
tease
go.
us like that. Ladies and gentlemen, Dr. Hershey Bell with us today. Dr. Bell, you personally, the legacy that you hope that this medical school leaves for future generations, medical professionals, and the community. What kind of legacy do you hope?
So you're asking a question that's close to my heart, close to Mike Nagowski's heart, close to Stan Warden's heart. There is no reason in a country like the United States of America that people should not have the absolute finest health care in the world. And part of that is having enough physicians to deliver it. And we are living in a doctor desert. I'm sure you've heard Mike say that on this show. The legacy we hope to leave to this community is to never again have to worry about getting the best health care right in your own backyard. And that is going to happen. And if people don't believe it, take a look at Pitt County. Take a look at Forsyth County. Take a look at Durham County, Wake County, Orange County. Wherever there are medical schools, healthcare is the best that can be in the country. And that's happening right here in Fayetteville.
Dr. Bell, what message would you like for the community to take away about the Methodist University Cape Fear Valley Health School of Medicine?
Well, that's the easiest question you've asked me today. So a lot of people say, hey, Dr. Bell, how's your medical school going? And the first thing I say to them is, you're asking the wrong question. It's not my medical school. It's your medical school. This is a medical school of, by, and for Southeastern North Carolina, Cumberland County, Fayetteville. What I want your listeners to know is this is their medical school. And I want to hear from them. I want to know what they need from us to be for the community, how we can best participate as partners in what we're trying to build here. This is your medical school. Be proud of it, rejoice it, celebrate it, and certainly come visit us when we're open.
And before we close out this segment of the broadcast, where can listeners go to learn more, to get updates, and to get involved in supporting the Methodist University Cape Fear Valley School of Medicine?
www.methodist.edu/medicine. We'll take you to our website. And stay tuned to everything that comes out from Methodist in Cape Fear Valley about what we're doing around philanthropy. I wouldn't want to leave the show without mentioning that this community has stepped up to give us almost, are you ready for this number? Almost $40 million already in gifts. The Golden Leaf Foundation gave us one of the largest gifts it's ever given, $8 million. And they're an organization that is seeding new jobs where jobs used to exist in the tobacco industry. And we're starting to see the fruits of that. Private philanthropy, the Duke Endowment, the Anonymous Trust, the Cumberland Community Foundation, the county commissioners, and where we really need dollars, Omega, is scholarship dollars. So those students from this region can afford to come school here. And we're fortunate that the scholarship dollars that we've been given so far are dedicated for students from our region. And we plan to spend that money.
Dr. Bell, thank you so much for taking time out of your schedule to be with us today. This has been an awesome conversation.
Well, thank you, Omega. I'm just thrilled to be here.
Ladies and gentlemen, Dr. Hershey Bell, he is the, hold on, let me make sure I get the correct title here. He is the Methodist University Dean of School of Medicine at Methodist University, as well as the Vice President and Chief Academic Officer at Cape Fear Valley Health. And again, thank you for taking time out and continue the awesome work that you're doing.
Thank you so much. And you too. What you do on this show is so important to the community. The community, the better they understand what we're trying to do in this community, the better this community will be. So thank you for all you do.
It takes a team. I have an awesome team. We have an awesome team. That's
Thank
all I can say. Ladies and gentlemen, when we return, we are going to talk about fibroids with Dr. Zayla Horgan, and she is a medical resident at Cape Fear Valley Health, and we're going to get all of the details when we return. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more